Sorry. If everyone could get a seat, we will be starting very shortly. Feel free to bring your wine or your water or your plates with you, and if we could fill up the front, that would be wonderful. And you can come too. We're not rolling cameras yet. Please join us. You're fine. Okay, we are not rolling camera yet, so my name is Karen Kaplan, and I will be the moderator for this evening's UTHealth House Calls. I wish I could tell you my name was Oprah, so I could say, and you get a car, and you get a car, and you get a car. But you're more than welcome to. You're not at the Astros game. You certainly deserve a car. So as most of you know, UTHealth House Call events are streaming live on abc13.com and Facebook Live and YouTube, so hence the camera. So we would love to ask all of you who are part of our studio audience, please try, and if you need to use the restroom, if you need another glass of wine, please do so now before the cameras are rolling, or you will be caught in the act of being yourselves. We also ask that those of you in the audience, if you also will use your smartphones to ask any questions of our speaker. And the way you do that is there's an instruction sheet on your chair, and all you're going to do is text the word Mercedes to this number, and then you will receive a thank you, and then you can respond, and then you can ask your question. And we try to get to as many of the questions as we can this evening. If, however, we cannot get to all your questions, please take advantage of the fact that this is a UTHealth house call, that we actually have the doctor in the house. And so whatever questions you have, please feel free to grab him afterwards while you are getting your flu shot, and he will be more than happy to answer them. And we do have a little bit of liquid courage there for anybody who's terrified of getting their shot. So in just a moment, we'll be going live, so thank you all, and we hope you enjoy the program.
Ready to roll?
You are ready.
Hello and welcome to UTHealth House Calls presented by Mercedes-Benz Dealers of Greater Houston. My name is Jerry Foyt, the General Manager here at Mercedes-Benz of Clear Lake, and we are so proud to partner with UTHealth to bring awareness to important health issues and the incredible work that is being done by the faculty, providers, and researchers at the university and its UT physicians clinics. And thanks to this partnership, I'm so pleased to announce that Mercedes-Benz of Clear Lake is once again giving 2 $5,000 scholarships to UTHealth, benefiting the McGovern Medical School at UTHealth. I would like to mention we have some special people here tonight, UTHealth medical students. We are excited for our guests to have the opportunity to connect with them, as they are the physicians of the future. Like all of us at Mercedes, these students are dedicated to the health and safety of our community. We welcome the students here to the Mercedes-Benz of Clear Lake. And now, let me turn the evening over to our moderator, Karen Kaplan, a medical journalist and longtime member of UTHealth. But before I go Astros.
Thank you, Mr. Foyt. And thank you again to Mercedes-Benz of Clear Lake for hosting tonight's event. UTHealth House Calls is a wonderful way to bring awareness to important health topics, and thanks to ABC13.com, a spectacular way to bring you the answers to some of the questions you probably have about your health. And now, the reason for you all tuning in this evening. Tonight's topic is influenza and its effect on the heart. And with us is Dr. Mohammed Madjid, an interventional cardiologist and assistant professor of medicine at McGovern Medical School at UTHealth. He has been researching the role of flu as a trigger for heart attacks and proving the efficacy of the flu vaccine in preventing cardiovascular events. Dr. Madjid is board certified in internal medicine and cardiovascular disease and provides care to patients at UT Physicians Bayshore Multi-Specialty Clinic. The Q&A portion of our program will be moderated by me, so please everyone send in your questions and we will get to as many as we can this evening. And without further ado, please welcome Dr. Mohammed Madjid. Go Astros.
Thank you so much. Good evening, and thank you everybody for being here. Thank you, Mr. Foyt, for making this happen, Karen. I'm an interventional cardiologist. I'm specialized in treating heart attacks. But over the past 20 years, I've been doing research on the ways to prevent heart attack. Heart attack is the #1 killer in United States and majority of the industrialized world. What causes heart attack? That's a question that we've been dealing with it for centuries. The main culprit for development of heart attack is a process, the Latin term for it is atherosclerosis. Essentially, it means hardening of the arteries. Pretty much the first one that anybody ever documented it was, by surprise, was Leonardo da Vinci. So it's been going on for centuries. We have found it, I found it in ancient mummies from 2,000 years ago. So it's a disease that has been with mankind for many, many, many centuries. And it's increasing, but we are controlling it as cardiologists. What causes the hardening of the arteries is primarily it's caused by accumulation and deposition of cholesterol in our arteries. Cholesterol starts to get into our arteries from very early ages, actually. By the time we are teenagers or in 20s, we may have plenty of those cholesterol plaques inside the arteries. And we know that it gets worse by multiple factors: high cholesterol, bad genes, if you have heart disease running in your family, bad habits like smoking, not being physically active, high blood pressure, smoking, exposure to smoking from other people, pollution, stress, anxiety. All of these factors lead to injuries, tiny, small injuries to our arteries over time. We are talking about a process of decades. And it starts very early, but it grows up. The plaques build up in our arteries. Once they are large enough, they block the arteries. That's when we have chest pain, heart attack, and other problems. The biggest change in cardiology field over the past 20 years has been a new finding that when we looked about 20 years ago, started looking at the arteries of people who died of heart attack, and we placed them under microscope, we realized it's not only simple buildup of the cholesterol plaques there. It is the inflammation inside the arteries that causes the heart attack. Let me explain it. You know by firsthand, family members, friends, neighbors, colleagues, who've been doing fine for many years. No problem. The guy was going to the gym till yesterday, no problem. What happened that over an hour at work, at sleep, while running at the airport in a rush, while driving, he had a sudden chest pain and dropped down with a heart attack. We have seen it. Something happens that these plaques have been there, dormant for many, many years, suddenly burst open, suddenly the heart is on fire, and the acute heart attack comes. That's when the inflammation comes in. Inflammation is our body's defense mechanism. Essentially, when you have a bug attacking you, like bacteria, body's white blood cells go and fight it, fight the infection. When you have a cut in your skin, body's defense mechanism go and repair that wound. This healing process is called actually the defense mechanism. It's part of what we call inflammation. But when there is too much of it, it can damage the arteries. Essentially, it's a wound healing process that goes wrong. So how can we find this inflammation? How can we prevent it? That's when about 20 years ago, I thought, okay, what causes the inflammation inside the arteries? We are not supposed to die of heart attack. We are not born to die of that. What causes it? The first thing that came to my mind was, what about infections? What about influenza? Why? Because every year we had influenza. Any age can get influenza. Anybody can get it. We can get it multiple times. And it comes in big epidemics, sometimes a pandemic, taking the whole population of the earth. And it can be deadly. Influenza is a very deadly disease. And the other thing is that if you got flu, you know how sick and ill you feel. There is what we call sometimes a $100 test. They say if somebody puts $100 there and says reach for it, if you feel too sick to reach out for it, you got influenza. That's because of the severe inflammation in your body. That's when we have these proteins in the body that fight infection, and there is too much of it, and that can damage the arteries. That's when I started testing what happens, for example, if we get these special mouse models that have very high cholesterol. What happens if I give them the virus influenza? I was shocked when I tested them with influenza. We looked under microscope. You know what the arteries look like? It looked like exactly arteries of people who die of heart attack. Then I looked at some population studies. These are all studies coming from Texas Medical Center. Houston, the McGovern School has been the leader in this field for over 20 years. Majority of the main studies came from our city. We looked at, for example, a very large number of patients over 8 years, 35,000 people who died and had autopsy. And we were shocked. We found that during every flu season, the risk of people dying of heart attack is 5 to 7 times higher. And other people around the world went and looked at it. I saw the same thing. Then I looked at some old literature. Then I was shocked myself. I found that during every epidemic over the past 100 years, if you look at big pandemic, except for 1918 Spanish flu, which was totally different, actually twice more people die of heart disease rather than pneumonia, influenza. And I'm a doctor. I was into medical school. I was trained that influenza is a lung disease. You know that, influenza, pneumonia, and all the problems. Then I realized that no, it's not the case. We see it every year. When the flu is in the community, we get a lot of people coming with heart attack to our hospital. So we did a lot of that, and other people followed, and we showed it. Then the big question came, if influenza can cause heart attack, what about the influenza vaccine? Can the vaccine prevent heart attack? So about 19 years ago, the very first study in the world came from our medical school at Memorial Hermann Hospital. We looked at a very easy study, people who had a heart attack and left the hospital. We looked at those who got flu shot versus those who didn't get a flu shot. And guess what? Those who got the flu shot had 2/3, 67% less risk of having another heart attack by the next few years. And the number is big. We thought, oh, maybe it's too good to be true. It wasn't. People went from Seattle, from France, from Thailand, from Poland, from all around the world and all around the other states, looked at it, showed the same thing. They reconfirmed what we found here. Actually, all the studies showed that there is a very big trend toward having less heart attack after getting the influenza vaccine. And guess what? You have patients in your family, I see this patient every day. There is a very big difference getting 1 shot per year versus taking, 5 to 10 pills every day. If it's as good as the other medication that you take every day, there is no excuse for not taking the vaccine. American Heart Association looked at the data, and now they recommend every patient with heart disease in America should get the vaccine to prevent heart attack. American College of Cardiology has the same recommendation. American Diabetes Association specifically says if you have diabetes, get the vaccine. Centers for Disease Control right now writes our national policy on this and recommends that any subject in United States 6 months or older should get the vaccine. There are 2 things about it. One is that you don't get the flu yourself. Also, you wouldn't give the flu to the dear ones living at the household with you. You know when we get the flu every year? As soon as the kids go to the school. They come and stumbling, actually, that's the problem. The children are the source of influenza for us, actually. I know. As soon as my kids start going to school, I've been sick the whole winter, because. So the vaccinating the children can protect the grandparents who live around them. That's one important thing for it. But you look at it and say, okay, we have a vaccine, which is very easy to take, very safe, very inexpensive, covered by any insurance. So you assume, most people will take it. I was thinking like that, but I was wrong. We looked at people, how many of the heart attack patients actually get this vaccine? Well, on average in United States, in the adults, 60% of adults get the vaccine. Children, in the schools, we are doing a very good job. In Texas, more than 95% of them get the vaccine, and all the vaccines that they need. We are doing a very good job on that. Heart attack patients, 60 to 65%. 1/3 of them don't get it. And it hasn't changed over the past 5 years, or 10 years, or 20 years. Hasn't changed at all. And guess what? I was reading the U.S. Chronicle the other day. The cattle in the ranches in our lovely state of Texas, what percentage of them get the vaccines that they need? 100%. Okay? So we are not doing a very good job of vaccinating the patients who actually absolutely need it. Okay? That's why we want to send the information. That's why we are here. That's why our friends helped set this up, send the message. And then I did a study. We did a random digit telephone survey, the ones that you pick up and maybe you just hang up as soon as you get it. We asked some of the political pollsters who do it before election. We asked them, let's do something good. Ask about heart patients around the country, what is the reason they are not getting. The number 1 reason was that we didn't know we are at high risk. We really didn't know that actually our flu can cause the heart attack. Time is changing, the world is getting at programs like this, but go ahead, get your vaccine, tell your loved ones get the vaccine, and help education, and eat well, exercise, avoid smoking, get your flu shot, and go Astros. Okay.
Thank you, Dr. Madjid. That was so helpful, and we do have questions coming in, and the first one is about the role that inflammation plays. So I think what this question is trying to ask is it inflammation that's systemic through the body, or inflammation only in the veins and artery leading to the heart?
You have a very good question, actually. Influenza and other infections cause inflammation all around the body. But for some very not yet known reasons, once we get the inflammation around the body, the heart responds to it by getting exaggerated inflammation at the level of the artery going to the heart. I did an autopsy study. I looked at unfortunate patients who has died over a period of 10 years in one of our hospital medical center. And these are the patients who died of other causes, big inflammation in their bodies. What I found was that, strangely, no matter where was the infection, like bladder, in the lungs, in the bones, in other places, the arteries of the heart was on fire. Somehow the body responds to it. In some of them, we saw signs of heart attack that the patient was so sick it couldn't even be recognized. The Time magazine once had a very beautiful paper about this inflammation in the body, how it causes heart attack, and they had a beautiful cover and they called it the fire within. And I really actually believe in it. I hope that answers your question.
It does. And so second to that is if inflammation occurs with viral and bacterial infections such as the flu, for instance, is taking the anti-inflammatory going to help with from a cardiac standpoint?
Well, that's a very good question. We know that some of the medications that we use to prevent heart attack, many of our patients are on it, like a statin medication to lower cholesterol, have anti-inflammatory effect. That's why we found that these medications prevent heart attack way more than we would have expected only by lowering the cholesterol levels. And the aspirin that I have many of my patients on it has some anti-inflammatory effect. So that's why we tell, if you're sick with flu, everything, call your doctor. He's going to give you medications, including antivirals, against that. I have 2 studies that I published that if you use those antivirals in the first 48 hours, you can reduce the risk of a stroke. And in one of the studies that we did in collaboration with Pentagon, it reduces the risk of having a second heart attack.
Antibiotics.
Antivirals.
Okay. Here's a question I have. Well, I think you just answered it. I have blood pressure issues and take a cholesterol drug. If I do get the flu, can I take one of the anti-flu medications like Tamiflu?
Correct. So they are safe. They should take it. We want to control your blood pressure. We want to control your cholesterol once you have it. And majority of these medications do not have an interaction. And again, that your doctor will be checking all these interactions and tell you about that.
Good. Are flu bugs becoming resistant to the vaccine, or do flu bugs evolve? And are they becoming resistant to Tamiflu as well, the antivirals?
Not so far. No, actually, the Centers for Disease Control checks for it, and FDA checks for it every year. So far, we haven't had that resistance. Around 5 or 6 ago, if I'm right, there was 1 year we had some resistance, but not so far.
Wonderful. We just got a question. Someone who had just received the shingle vaccine a couple of weeks ago and wanted to know when they can get their flu shot in relation to their second shingles vaccine. Do you have to wait to get the flu shot?
There is no non-interaction. That should be fine to take that vaccine.
Okay. All right. Should I treat my fever, or does the fever of my flu have a protective effect?
No, actually, you really want to treat the fever, okay? The protection comes from our medication that we have for this.
Ah,
okay?
so my grandmother
so we
is wrong.
really want to lower the flu, fever.
So the fever does not burn out the flu?
No, does not.
Okay, if the flu is that dangerous, then how come we cannot come up with the universal flu shot?
Well, we want to come up with one. There are technical challenges with it. There are many investigators around US and around the world who are trying to build it. It's very technical. The problem with influenza is that it changes its face every year. Flu is a gamble of nature. Unlike other viruses or bacteria, its gene is in 8 different pieces. And think about these 8 different ones getting shuffled together every second, every minute. Flu is not only limited to humans. Majority of the influenza that we see, actually the ones that we get every year, it comes from birds and from pigs. There are hundreds and hundreds of flu viruses in those animals. Very few of them can get transmitted to humans. So every single day there are new flu strains being built, majority of them in China. For the past 100 years, majority of pandemics came from China because one strain out of 1 million or something, we don't know the exact number, will be able to jump to humans. And it's the newest virus that humans have never seen it before. So nobody's vaccinated against it. Nobody has the antibody from the infection 20 years ago in their childhood against it. So we are not prepared for it. That's when a pandemic comes, because the humans are seeing a new virus that they haven't seen before. That's why we ramp up the effects. That's why the government takes control of it. The pandemic planning, we want to build a new vaccine very quickly to tackle it. Fortunately, it doesn't happen very often, but on average, every 35 to 40 years, we get it. 1918 Spanish flu, when it came, 25% of people who had it died, and they were young people. And that's actually what placed an end to the First World War. Essentially, the soldiers died so much on both sides that they couldn't continue. So we want to build a universal vaccine, but the vaccine changes every year. We have to get the new vaccine. That's why you had the vaccine last year. This year, we have to get the new one. Unless we come with a vaccine that covers all of them, we have to take it every year.
Thank you. That explains a lot. Can a horrific cough attack during the flu give someone a heart attack? Just the actual, I think, violent spasm of coughing.
Oh, that's horrible. But I hate the coughs. I get them myself. No, but it feels like a heart attack. It doesn't cause the heart attack. Okay, but the virus itself is going to cause the heart attack.
I have heard that this year, I'm going to ask 2 more questions and we're probably going to wrap up. I have heard that this year, this is one of our questions, is going to be a particularly rough flu season. Have you heard that as well?
Correct. I heard it, and it is based on the fact that influenza virus comes here in the winter. Right? Do you know where it disappears in the summer? It goes to the southern hemisphere. So the days that it's 100 degrees in Houston in middle of the August, it's freezing in Australia. And they're in middle of their flu season. And that virus changes and comes back and returns here in a different phase again in our winter. So what happens in Australia, in the southern hemisphere, during our summertime predicts what we're going to have in US in our winter time. So Australia had a very bad season in their cold season of August. Okay, I know it was 100 degrees here, 110 some days. But that tells us that we're going to have a very different, very bad season this year. Again, it's a gamble of nature. Everything might change. We just predict. That's why every year we predict what is coming this year, because the vaccines that we have on the table are based on the prediction from the rest of the world, what was happening a few months ago. That's why sometimes, but we get taken by surprise. Suddenly a totally new thing comes and our vaccine may not work.
That explains a lot. All right, I'm going to ask this last question, and it has to do with some of the research that you have done, sir. Research that you have, tests that you have run on ancient mummies that showed that they had just as much heart disease as we modern people, yet they died much earlier. What was the reason of their early death? Was it the flu?
We know that they had atherosclerosis. My studies showed that they did have, 2,000 years ago, our ancestors had cholesterol in their arteries. So they did have the genes, the family history to have high cholesterol. They did have some components of lifestyle that that led to that inflammation in their arteries. We don't know if it was flu or not, but most likely, the humankind has been dealing with influenza since the beginning of time, okay? It has caused mass casualties over many, many years. Our ancestor may not have lived long enough to get the heart attack, okay? But now we are living many, many years, okay? So we want to die with the cholesterol plaques because it's inevitable to some extent, a small amount of it, but we don't want to die of cholesterol plaques.
I couldn't agree more. Thank you so much, Dr. Madjid.
Thank you very much.
Thank you for urging us to take the flu seriously. We have people standing behind there who are doing everything they can to make sure that we do not walk out of here without a flu vaccine. And thank you in particular for explaining the role that this virus has in our heart health. Your research saves lives, that is, if we take your advice and put it to good use. I would also like to thank ABC 13 for giving us this incredible platform to inspire our community to live healthier lives through these events, to extend our gratitude to UT physicians, our partners in health from McGovern Medical School, who teach, train, and treat, and provide the highest quality care for our families. Tonight was the penultimate UTHealth House Call for 2019. It is such an honor to partner with an organization that really does walk the walk and talk the talk when it comes to health and safety, whether it's through the safety of the engineering of their cars or the safety and health information that they so generously share with the Houston community. Thank you, Mr. Foyt and Mercedes-Benz of Clear Lake for making this evening possible. Our next and final UTHealth House Call for 2019 will be November 14 at 6:30 on abc13.com, and the topic will be emergency medicine, just in time for the holidays. So to view tonight's program, please visit abc13.com and go under promotions, I believe. And this program will live there, so probably for as long as you wish to view it. So thank you all, and we hope to see you next time.